Myasthenia gravis, or MG, is often called the ragdoll illness because it causes patients to have muscle weaknesses, muscles that they can't control without treatment. Myasthenia gravis is classified as a chronic autoimmune neuromuscular disease characterized by varying degrees of weakness of the skeletal or voluntary muscles of the body. Autoimmune is a condition which means that the body's immune system actually attacks itself, weakening the voluntary muscles that control the eyes, the face, throat, and limbs. And the muscles help us breathe, so if it isn't treated, it can be dangerous, even life-threatening, hence the word gravis in the description. Very often, the first signs are droopy eyelids or double vision with weak facial movements or change of having a nasal voice. More seriously, patients may have trouble with swallowing or breathing. When swallowing is weak, patients can actually breathe in particles of food or drink, often without realizing it, and getting pneumonia as a result. The arms and legs can also be affected, as you can see in the script of the sufferer who is not taking medication. The cause of the weakness is actually very complicated, but we have to know this to be able to understand the effects and the treatment. If you want to move an arm muscle in your body, the source of the signal is actually coming from the brain and travels as an electrical signal down the spinal cord to the nerves of the arm. The muscle contracts in response to this signal. What happens in this neuromuscular junction is fundamental to our understanding of the harms in myasthenia. The problem is that there is a gap between the nerve and the muscle. When the electrical signals reach the end of the nerve, they cause it to release a chemical called acetylcholine, which diffuses across the gap and binds onto special proteins called acetylcholine receptors. That triggers off an electrical signal in the muscles, which results in the muscle contracting. When you want to relax the muscles, the messages stop coming down the nerve, and with no more acetylcholine, the system resets itself. The problem in myasthenia gravis is that the immune system destroys some of the acetylcholine receptors, so there are too few to trigger the muscles efficiently, resulting in muscle weakness, and the harder patients try, the weaker they become. But with the aid of drugs, walking unsupported is possible. Because MG is relatively rare, many doctors have not come across it before. Diagnosis is often delayed because muscle weakness is a common symptom in other diseases and may slowly develop. A simple test is to see how long the patient can hold up an arm or leg or stare in one direction. Blood tests for the damaging immune antibodies will help diagnosis, and electrical tests on nerve-to-muscle efficiency can also confirm it. Myasthenia gravis is not directly inherited, nor is it contagious. It commonly affects adult women, usually under 40, and older women, usually over 60, but it can occur at any age, and at the moment, it's not curable. but it is manageable with medication to stop the breakdown of acetylcholine ignition keys of the neuromuscular junction so that they have a better chance of triggering. Much more research is needed to find a cure and to discover what causes the autoimmune reaction to start with. In the past, the disease can lead to death, but with breakthrough in medication and treatment, this is now very, very rare.